So the baby boomer generation is the largest generation right now, the largest growing population right now in the United States, between ages 68 and 50. They're different from the silent generation in that they do believe in more of individual choice and self-actualization, but they are similar with the silent generation in that depression is something that they also deal with. And also with this generation, they are the first sandwich generation, and so they're the examples of caregivers who are in the United States. They're our first example of doing that. Prescription drug issues and alcohol misuse is something that this generation also deals with. And as you know, Robin Williams has passed away recently. He's an example of the baby boomer generation. And so my question when I'm thinking about the generations is how do we get our seniors to access available mental health resources? Well, first of all, one of the things is that family members are the key, okay? And so working with family caregivers is something that, as we're working with the aging population, is something that we specifically need to do. And sometimes getting an older adult to access mental health resources can be a challenge. But 67% of family caregivers provide care for someone ages 75 or older, which tells me that that's a major resource that we have working with this population, with these two generations. Family members are necessary trusted partners in working with this older adult mental health and also in the mental health population. And so basically, the family members are the bridge in connecting mental health resources with the aging population and also receiving care. And so I kind of use the acronym PAIR, Proper Approach in Receiving Services. Family members are that bridge. So in the next couple of slides, I want to kind of go over some of the specific resources for mental health. As a psychotherapist, I do provide individual, family, couple counseling. And I also want to talk about some other resources such as inpatient and hospitalization and doctors, okay? So individual psychotherapy. Has anyone recently made a referral to mental health resources to aging population within the past 3 months or so? Yeah. One person, yeah. I think it's interesting in that understanding how we make resources and when to make referrals is important. And so with making a referral to individual psychotherapy, we got to look at the signs and symptoms of depression, specifically with our older adults. And so anxiety and depression in older adults is very common, as we'll talk about later. But caregiver burnout is something to look out for as well, and we're working with the older adult population and their family members. And so caregiver burnout really looks like this. It's someone who is extremely tense, irritable, angry. They also are more likely to receive a diagnosis of major depression. And so when we're looking at caregivers, individual psychotherapy is something to really look at for a referral base. They can assist with developing new skill sets and understanding how to deal with their depression, helping with challenges in transitioning with the older adult and their lifestyle. And who can provide these services? Basically, any licensed mental health provider. So that includes a licensed clinical social worker, licensed marriage and family therapist, psychotherapist, psychiatrist, psychologist. Okay. Next is family therapy and couples counseling. I think this is unique in that as we continue to work with aging, understanding that the family is the key to this. So working with the aging, the family members are actually the main resource for these individuals. And so we will be remiss in not working and doing some type of referral based if we're seeing some issues related to family members and the crisis that happens. And working with families and intergenerational populations, we're dealing with different kinds of conflict and poor communication sometimes. When we have couples who are married and they have mom or dad come and live with them, couples need to talk about that. They need to understand how to renegotiate their roles and responsibilities.